Very often, the fear of cancer treatment is more than that of cancer itself. This is because of the nature of radical surgery usually associated with the cancer, where the affected body parts and the surroundings and connected immune system are removed. Chemotherapy and radiation are associated with a number of side effects like vomiting, hair loss, fatigue, etc. And also the constant fear of cancer recurrence remains. Cancer is a lifestyle disease. It is not the lack of medication or surgery or radiation causes it. On the other hand, some medicines and radiation can cause it. In modern medical practice, in cancer treatment, lifestyle correction does not get the importance it deserves. What is the reason for this? Why is treatment of a lifestyle related disease not giving importance to lifestyle correction? This is the question that should be raised by every cancer patient and their well-wishers. Very often, when the cancer is diagnosed, the patient may not have pain and suffering, but very often, it is when cancer treatment starts that the patient begins to suffer from pain and other sufferings. For patients in stage 3 and stage 4, even with surgery and chemo and radiation, it is often not possible to save the patient. Then why is it that such operations and procedures which increase suffering are carried out? Are cancer treatment is helping the patient or is it increasing the suffering? To understand this, it is necessary to evaluate the treatment of patients of different cancers who were treated at different stages of their cancers with a different type of medication and treatment protocol. Only an understanding of the connections between the lifestyle and cancers can help in understanding how to correct lifestyle to stand up against cancers. We can see how lifestyle corrections benefits patients suffering from different types of cancers and at different stages. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind the disease, measures for early detection, investigation to assess the impact of the disease on different parts of the body, available treatment options in modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. To understand the cancer, first thing we should understand that cancer can affect any part of the body, like a skin cancer can be there, eye, ear, or a nose, internal part of the nose, or any organs like liver, kidney, gastrointestinal tract, that is stomach, intestines, or colon, anus, any part of the body can be affected with the cancer. We know that even the genital organs, the men, the prostate cancer is very common, and in the ladies, breast cancer, and the uterine cancers, ovarian cancers, so any part of the body can be affected with the cancer. What is the reason behind it? Basically, the reason is mutations happening in the cells. That is genetic, DNA, that is the genetics is actually deciding everything. Because of the toxins and nutritional imbalances, while the cell is dividing, actually our body is changing every second. There are so many cells, new cells are produced in the body, and so many new cells are dying and it is removing. And in this process, every second there are so millions of cells are born. And for that, nutrition is necessary. And the death of the cell, one of the reasons can be aging. The other thing is toxins. Toxin can be virus, bacteria, or the chemicals in the food, atmosphere, from the air, water, and everything. Toxins are getting inside. They are the causes for actually what is happening. with this, when the cell is making a copy of the genetic material actually, that time there is an error happens. And because of the accumulated error happening, the mutation occurs. And this mutation is the reason for the mutation in the somatic cells. The general cells are called as somatic cells. The other type of cells are there. This germ cell that is related to the testis and ovary, that is procreation related cells. So that is this germ cells. This germ cells, it happens, it will be a genetic disease. But in the somatic cells, even the mutation happen, it can go to any disease, and mutations are the reason for most of the diseases actually, even this autoimmune disease and many others. But in the cancer, where there is accumulation of this genetic DNA damage, and finally the cell loses its control of division. But then the multiple cells are formed, but they will not be of quality. They will not be able to do their function also. That is why blood cancer, the number of cells are increasing, WBCs or whatever, it will be increasing. But the patient is not able to deal with the infection, or the cells will not be of quality. That is the problem. And another thing is, basically everyone should understand is about the fat what we are eating also, or the fat accumulation in our body. Actually there are 4 types of fat. Out of this, the essential fat, omega-3 and 6 is there. Actually they are the controllers of the immune system. The omega-3 is helping on the regeneration and repair of the body, and omega-6 is fighting, that is defense oriented. In our general food, omega-6 is very high and omega-6 is too low. So this balance is gone. Actually all these lifestyle disorders, especially the cancer, is an inflammatory disease. It's actually the tumor growth and it's a sign of inflammation. So in cancer patients, the omega-6 level will be high. So what we had to do is to increase omega-3 and reduce omega-6. That is in many of the studies also shows that the omega-3 balance for the human, for the ideal genetics, according to our genetic, it should be 1:1. But it is too high, 1:40, 1:20, and depends on what you eat actually. It all depends on what is the food you are taking. Next, when we come to the diagnosis, it is when the tiredness, actually most of the places we feel that internal organ, it is maybe tiredness you are feeling. Next is a swelling. If it is a breast and external, we'll be able to recognize the swelling first, or even with the scanning also, even the liver or kidney, whatever is the swelling, we are picking up with the investigations also. So tiredness can be swelling, then the bleeding can occur, and also the fever and pain. Those are the symptoms actually. So it can occur with any disease, so we'll be investigating and then only we'll be able to find out. Then what are the investigations? Blood test, how we can find out it is in the early stage. The first things appear actually will be the blood inflammatory markers. Inflammatory markers like maybe different type of food. So for each cancer it may be different inflammatory markers, but generally the C-reactive protein, ESR, blood count, etc. can go high. Then in some type of cancers, actually most of the cases that autoimmune disease comes first. That is one example is the thyroid gland. Thyroid gland, most of the thyroid people, they get it after they develop the Hashimoto's thyroiditis or some type of thyroiditis. That is, this is an autoimmune disease. This thyroid markers will be first increasing. Then it will be diagnosed as Hashimoto's thyroiditis. And after 10 or 15 or 20 or 30 years, the person may get a thyroid cancer. Or first maybe diagnosing it as a thyroid cancer, but when we check into this autoimmune at ATG and TPO, etc., it will be increased in most of the thyroid cancer patients also. Next is tumor markers. Actually, nowadays with the increase in the diagnostic facilities, there are tumor markers are there that we can check it in the blood, and we can very early stage we will be able to find out the possibility of cancer. But when the cancer cells, the changes happens itself before the swelling and all appears, that is just much before the swelling can be detected in the scan, the tumor markers will be increased most of the cases. For each cancer there will be specific or some sort of commonality also will be there for this. The one example is PSA. PSA is for the prostate cancer in men, and CA125, that is for the ovarian cancer and uterine cancer, and CA19.9, that is for the pancreas, and the CEA, that is mainly for intestinal cancers, CIFRA for lungs, and so many cancer markers are there. So each will be specific. So if you are able to do in an yearly basis, especially when you are after 40 years, if you are able to, that is usually after 40 the cancers are mainly coming. And so if you are able to a panel of tumor markers, you will be able to pick up it very early and not to wait for. If you see some PSA is high, then you need not go for, actually if you are able to pick up, you can just correct your lifestyle and you can get out of it. So you don't have to wait for, generally there's no problem. If PSA is slightly increased, then either biopsy, go for biopsy or wait for some time. But whatever is, you should do the lifestyle correction and see that it is getting corrected. Don't just lead the same way, go ahead with that, just wait for the PSA to increase, then go for surgery, radiation and so many other things. Next, when you are diagnosing, then once if you are definite about it, this, if you are, usually what is happening is the scan, it is positive, there is a tumor, then go for a biopsy, and then usually the scan can be ultrasound scan or PET scan or this MRI, CT scan, etc. But if you take an example of a breast cancer, if you get a swelling, you can go for definitely go for an ultrasound scan, and that itself will show that there is calcification and some signs of breast cancer, and there is lymph nodes are there, the spread also. But the final diagnosis and staging can be done by a PET scan. The PET scan, actually it is identifying the physiological activity of the tumor cells. So there will be more glucose uptake. Actually glucose uptake is the measure or to identify the cell is cancerous or not. So the final diagnosis, if you actually you can, if you are, the biopsy is painful for a prostate biopsy or a breast biopsy, it will be painful, and also if you are, the whole part of the tumor may not be showing the cancerous change. So only from the part which is taken we can say whether it is a problem, cancer is there or not. So more specific is, if you have a strong suspicion with an ultrasound scan or any other thing, then go directly for the PET scan will be more ideal. Because I am regularly seeing that patients who first they have done an ultrasound scan, then a CT scan, then go on an MRI scan, then a biopsy, and finally they come for By the time is also your time is very important for when you are diagnosing also, because after the biopsy you have to wait for more time. If it is suspicious, and a repeat biopsy and so many complications. So if you in India, that is one of the advantage also. Here a PET scan is costing only around 17,000, 18,000 rupees. So we can get a clear diagnosis. Even the CT and MRI also will be costing around 10,000 and all. So you can go directly to the PET scan and get the result, and the pain and discomfort will also can be reduced. That is, PET scan is not for everything, only if you are really suspecting. For some other signs like a tumor markers is increased or ultrasound scan shows that cancerous changes is there. In those cases, because all the scans, including the PET scan, has exposure to radiation is there. So it is not just for screening, or it should not be used for a screening. But if it is a strong suspicion is there, we can go for that. Next, when we come to the treatment of the cancer. So the general, whatever is the cancer, the primary mode of treatment is, one is surgery, remove the affected part with a wide excision, and whichever is the part, and then is radiation, or chemotherapy, which depends on the cancer, it will be the stage. And chemotherapy, there are so many. Radiation also, there are so many methods of radiation are there. Brachytherapy, direct, and different type of even intra-surgical therapy, and so many things are there. Different modality of radiation giving is there. And also chemotherapy is a large area actually. It's actually started with actually first chemotherapy is developed as a from a war gas actually. It's called mustard gas that is used in the First World War and all. It is actually it's come to the medical field actually after the postmortem of this these people died because of this mustard gas. Their bone marrow was depressed. The bone marrow was actually even if the this victim has escaped from the gas bombing, they will develop within few days. They will die of infection actually because of the bone marrows that our immune system is affected. So from that actually we understood that it will suppress the bone marrow, the immune related cells. So from that we developed the first chemotherapeutic agent for the blood cancer. So after that so many medicines have come, and the latest in the line is the targeted therapy type of biologicals and the immunotherapy. That is a different name it is called. It's more less side effects and more effectiveness. That is what we are trying to bring in. But the problem is whatever is the medication or the surgery or the radiation, it is actually destructive. We are trying to destroy that part. But if when the radiation, that part is exposed. So if it is a bladder cancer, the surrounding area will be affected, or even a uterine cancer, the bladder will be affected. So you will not be able to focus on only that part. So that surrounding area will also get the impact, and because the side effects will be from that. And the chemotherapy, if it is intravenous and all, it will be all part of the body is affected. But in the latest is in the chemotherapy is the embolization, that is injecting into a particular part of the body. Or if it is a liver cancer, into the go into the canalization and go into the liver and inject the medicine. There also the problem is high dose of medicine is injected into a vessel. So the surrounding part of the liver also will be definitely affected with it. So a patient had seen that patients without final diagnosis of biopsy and or giving embolization with the chemotherapeutic agents just because of his swelling, and the patient is already having some liver problem. Usually this liver cancer develop those patients with chronic liver disease with the cirrhosis and all. The patient may go because of it is not that part alone. Even though you are injecting into that part, that liver cells surrounding normal cells also will pick up the impact. Already the liver is compromised. Then the patient can go into a liver failure. And even the hormone therapy, everything has its own side effects also. Hormone therapy is usually used in genetic cancers like prostate and ovarian cancer, breast cancer, etc. Here actually it is suppressing or blocking that activity. There also the side effects, especially that bone demineralization, the bone will get weakened because these sex hormones are very important for the development, not only for the sexual activities, the bone and brain activity and everything. These hormones have a part actually, this testosterone or the estrogen and all. So if it is blocked, that also can be affected, the fractures and so many complications can come. That is the problem with any medication with the cancer for when we are approaching the treatment. Then so many, even the surgery, that major part will be also removed. The patient is already inflammatory and sick, and removing, especially it happens in usually 70 years or 60, above 60, so 70, 75 years and all. The major radical surgery, this cancer surgeries are called radical surgeries. So the patient may not be able to have the stamina for recovering from such a extensive surgery, and there will be damages, nerve damage, and so many, and continue the pain, and it will be very difficult to recover from the surgery. That is the problem. So then what is the real solution. Basically, we should understand that cancer is a lifestyle disease, but no one is giving much importance. But later some studies are coming out. The studies are also showing that patients are not given. The patient will be given treatment in major centers and all, but they are not guided in the proper way on the lifestyle disease. That is the major reason is the doctors and the modern medical doctors are focused either oncologist or radiation expert or the surgeon. There will be three kind of specialists will be looking at. There will be the surgeon will be focusing on the surgery part. The chemo-oncologist will be concentrating on the chemotherapy part, and the radiologist will be radiotherapy expert will be this. But the major problem here, or the root cause of cancer itself, is the lifestyle problem, and no one is taking care of that part. No one is looking into that part. That is the problem. Actually, we are actually have this in the modern medicine dealing 90% of the problem is the lifestyle disease. But no one is giving importance for the lifestyle such, but giving importance only for the medication, surgery, and such things only is given importance. That is the so the real solution also comes in the lifestyle correction to see why this patient got the cancer and what are the food habits, what are the lifestyle factors which has created this. That we have to find out and correct the give optimal nutrition, optimal exercise, and help the patient to get this toxins if it is any toxic elements are there in the body. The most important toxic element is the medication itself. Most of the patients who are getting cancer will be on long-term medications for especially the old age, the diabetes, one of the major diabetes, hypertension, heart disease. They will be taking all the medicines, and all these medications we are taking is anti-inflammatory. That is suppressing. Actually, they are suppressing the immune system. If it's an allergy and autoimmune disease is there, there will be steroids and direct immunosuppression will be there. So that is the reason for the cancer itself. Even the type 2 diabetes patient, there is no deficiency of insulin, but we are injecting insulin again. Insulin is cancerogenic. Why? Actually, when the insulin is there, the immune system will not be able to function. And most of the patients who are on insulin, they will be having 1 or 2 night dose. Evening 1 dose will be there, and I have seen one patient is saying they have 3 times plus 4 times insulin. 8 o'clock night also, 8 o'clock one insulin and 10 o'clock another insulin dose. So you are actually in the night the immune system is non-functioning to trying to remove these cancerous cells and all. And that time if the insulin is high, the immune system phagocytosis, one of the major aspect of the removing this cancer cell, will be shut off. So the chance of getting cancer for this diabetic patient, especially on medication, type 2 diabetes patient on insulin, and even many of the medicines also is increasing the insulin production. So the chance will be very high. We can say it is this medication itself is cancerogenic, not directly as a toxin, but indirectly by increasing the insulin level itself. Next we will see what is the changes which has happened, or what was the benefits for a few patients who has undergone clinically supported lifestyle correction for after diagnosing cancer. So first is we'll see a patient. She's very young lady, 42 years, 147 centimeter height, a short lady, and 51.4 kilogram is the weight, and she has her child is only 5 years, very young, small child also is there. And this lady was found to have some breast swelling, and she had gone for a ultrasound scan and mammogram. They said that it is okay. They had done a biopsy 6 months back, but again the swelling was, she felt is increasing, and then again it is done, and then it is cancerous growth is there. So because when she diagnosed with when she got the biopsy report itself, she came for the lifestyle correction actually, and the biopsy report actually showed that invasive carcinoma of the breast, the ductal carcinoma. That was the diagnosis. But to reach the diagnosis, actually, she has undergone many times because patients will be shifting to, they will be in a difficult stage to believe such things, such a diagnosis. And this young lady was also very reluctant to talk itself. Actually, she was so depressed and she was not willing to talk to the medical people also when she came, because she is having a small child and she don't know what to do actually. So anyway, she started with her husband was very supportive, and she started with the clinically supported lifestyle correction. Meantime, the investigations, they were going for the biopsy confirmation. Already there is one biopsy. Then again, it depends on the hospital also. They will be doing repeated testing will be there. And she has done actually already 2 mammograms, 1 CT scan. Again, meantime, I had asked for actually a PET scan. But before, instead of that, the other hospital, which is the cancer center, they had done an MRI, and again a bone scan also was done. But that also shows that there's second stage 2 cancer is there. But MRI will show only that local spread. You cannot find out distal spread like a brain or liver, or you will not be able to diagnose that. So finally, after 1 month, and also the surgery is because in the government sector and all, it will take some time for the surgery. So this patient actually, she came on November 2nd, and she started the lifestyle correction from the November 2nd itself. Along with that, she was undergoing few tests and all at the cancer center also. And finally, she was given a date for cancer surgery. Actually, initially she was asked for radical surgery. That time actually she came here. And radical surgery, that is removing that breast and the immune system cells associated with it totally. But they were very reluctant for going for the surgery. Anyway, she was very actively looking at, her weight was actually, her body composition, when we looked into, was actually her fat percentage was very high, around 35%. She with the lifestyle correction in that actually optimal nutrition, optimal exercise, and this toxins, reduce the toxins. And when looking into her, she was allergic to so many routine things like egg, milk, ladies' fingers, cucumber, etc. So she was asked to avoid the things which is reacting to her body and reduce the weight and reduce the fat content in her body. And she was, by the time 2 months, she was before the surgery. To get a date for the surgery was actually, this date was on 8/1/24. January. November it was diagnosed, only in the January she got the date for the surgery. By the time the tumor size also reduced. Actually, just before surgery, the PET scan also was taken, and PET scan also showed that only few lymph nodes are affected, and the tumor size was much reduced from the initial stage. The doctors, the cancer center also are agreed to take out only the tumor part and the lymph nodes, which is this screening lymphadenopathy, the abnormal lymph nodes and some suspected lymph nodes only. That was the advantage for this patient. Actually, if this patient is continuing just without going for the lifestyle correction, by the time she must have reached the 3rd or 4th stage itself. We can't say, because she was so depressed. When a person is depressed, the immune system is going further, and the cancer spread will be also very high. Because of this, actually, she was able to come down to 45 kg at the weight reduction, and her fat percentage also reduced to 32%. And she was in a very good mood, in a very good spirit to go for the surgery. There is no radical surgery, only that simple surgery, that is removing this tumor. That will definitely help her. The tumor load will be reduced. So her immune system will be to look after only to prevent the spread or the local spread or whatever is there. So after the surgery, by the time she was cope up with the surgery, only she needs rest for a week only. She was able to do the exercise and all after 1 week itself. So that, and she was able to avoid the major surgery. And now by 3 months, the next 3 months after the first, before the surgery, there is a PET scan. Now again, a PET scan is needed to make sure that everything is okay. And I have asked her to, before the PET scan, she should bring down her weight to below around, she's only 147 kg, below 40 kg, and fat level at least below 30%. And that biopsy report also shows that a clear margin, that is, margin is very important. Only few lymph nodes, they had taken around 20 lymph nodes, only 4 lymph nodes was positive. So the tumor surgery was very simple and remove all the cancer cells. So she said, otherwise after radiation, then this radical surgery, then chemotherapy, then radiation, and so many procedures will be, and the destructive medication, radiation, everything will be needed. But she was able to fix with a simple the lumpectomy and a few sampling lymph node problems. To see the benefit of lifestyle correction, we take one more patient. This is also a cancer patient. She's 72 years, lady, 151 centimeters height and 66 kg weight. She is diagnosed with the cancer and this breast cancer, and before this PET scan and all, she was also advised to go for a radical surgery after removing the breast. And then biopsy proved that is lymph nodes are positive, and also the breast swelling is clear carcinoma. Then finally, the patient insisted for a PET scan also. Then the PET scan showed that there is spread to the lungs and the parotid gland also. So secondaries in the lungs and parotid gland, stage 4. And again, that cancer center has advised the radical surgery, then radiation, and then chemotherapy. That was the advice given for them. And she was not at all willing for the surgery because she was working in palliative care. So she knew that what will happen after the surgery, chemotherapy, and what is the result. She was very, very known. Even their relatives and children were compelling for the surgery and the traditional way of treatment. She was not willing for that, and she wanted to try with the lifestyle correction. So she is a patient who was on diabetes medication for 15 years for the diabetes and dyslipidemia, that is cholesterol, statin and all she was taking. And now she is in a very bad stage. Even she is having pain because the swelling is very big swelling on the breast, and she is having discomfort in not able to sleep properly. And 2-3 medicines for the diabetes and gastric problems is there. There's usually with medication, gastric problem, for that pantoprazole is taking. And with the lifestyle correction, when we start with the lifestyle correction clinically, I mean the lifestyle correction, the patient self-correction and the clinically supported lifestyle correction which I follow will be different definitely. And in this we stop because there is clinical support is given. We are giving the nutrition and everything will be according to the under monitoring. So special food and special exercise. And in that actually her when we look into the blood with this also, with this medication also, share HbA1c is very high, 8.7. And so many inflammatory markers are high, and vitamin D level and many of the vitamins are in the low level and all is there. So her she's obesity is there, fat percentage is almost 43% fat. Ideally only 25% fat is only should be there. So this her insulin level is normal. So it's a type 2 diabetes. In type 2 diabetes patients, stop the diabetic medication, whatever is insulin or diabetes tablets, everything, because the patient's pancreas is producing enough insulin. Only thing we have to reduce the carbohydrate. Reduction of the carbohydrate is essential for controlling the diabetes and also controlling the cancer. The cancer cell needs glucose. We have to cut the glucose to the cancer. We cannot cut the glucose to the cancer cells alone or to the breast alone. So we have to cut the glucose intake as such. And if the glucose intake is reduced, definitely the sugar level will come down. What we want is the general sugar level should be around 70 to 100. That is the ideal blood sugar for a cancer patient, 70 to 100. That is not with medicine, without medicine. So that is what we are trying to achieve for her. And for a normal non-cancerous diabetic patient, the reversal, diabetic reversal means to bring down the HbA1c around 5.5. For a cancer patients, bring down the HbA1c around, preferably below 5 will be ideal. Why? This cancer cell, if they want to grow, the glucose is needed. If you cut the glucose level, then you will be able to, you are starving the cancer cell, they will just die of. So that technology, that is actually we are using, and along with that, not only that, we are providing, making sure that the patient is getting all the nutrient in the correct proportion. So what happens then? This is a first stage cancer. What will happen to her? That is, everyone will be interested. Actually every month we will be following with the ultrasound scan. And every 3 months, in the initial 3 months, after the initial 3 months itself, we repeated PET scan also. The symptomatically, the thing is, within a day itself, her sugar is normal, by 15th day itself, their cholesterol and all the medicines are over. And she was taking BP medicine, all the medicines are over by 30 days. And her HbA1c came down to from 8.8 to 6.3 within 30 days. 30th day, and by 60th day it came down to 5.4. So, and also her weight also reduced. By day 90, her BP weight was come down to 53. See, actually, and 53, and the fat level also came down to around 40%. So that is the thing what we want also. And ideally she is only 151 centimeters height, and we want to bring down her weight to around 45 or 42 preferably. So the excess fat accumulated in the body will be definitely of the omega-6 nature, that will be inflammatory. And reduce this omega-6 fat is stored in the body and increase the omega-3 content. That is the aim of, that is the one of the reason for reducing the weight. So this patient is almost a year, she's doing the follow-up regularly, and she's fine, and the children is saying that she's healthier than us, and she's doing all the activities, she's very happy and pleasant and doing everything. See, if she goes for the surgery, what will be the situation? They will be continuously in this years, she will be visiting the hospital. And she is free from even the diabetes and hypertension and all the medications, and she is very healthy. Only by the 180 days, that is 6 months, PET scan shows that there is reduction in the cell uptake also. But don't expect everything will be just gone like that. It will take some time, and after this secondaries, the outside the things are okay, you can definitely think of that tumor removal with that lymph nodes also can be removed actually. But I told her after 6 months we can remove that, so that tumor load will be less, the immune system will be more comfortable. But she was not at all willing for the surgery at all on her. Next we will see a prostate cancer. This is a 53-year-old man. His height is 167 centimeters, weight is 53, not obese or anything, ideal. And he is diabetic for the last 18 years. And now he is having urinary retention actually. She was diagnosed with benign BPH, the benign prostatic hyperplasia, and now he is having urinary retention and severe pain, and his PSA is increased. 25 is there. The doctors have advised him to undergo an immediate prostate surgery. In that stage, actually, he is coming. And this patient also is on medication for diabetes, but even though this is on medication, his HbA1c is 7.5, and insulin level is high, 28.2, and many vitamins and everything is inflammatory also. When we look into, he's having a urinary infection is also there. So with this, when his insulin level is high, so we stopped the C-peptide. Because he's taking insulin, C-peptide also we looked into, and C-peptide also is high, 5.5, 5.6 is there. So definitely his pancreas is functioning. So we stopped the insulin. When we stop the insulin in a cancer patient, the advantage is the immune system will function in the proper way. And also he is having an infection. So the immune system should function in the proper way. Then only the infection, he can overcome from the infection, and also if the cancer activity is there from the cancer. So we stopped the insulin and put on low carbohydrate and with an optimal nutritional diet and mild exercise. He's not in a position to do much exercise, but his exercise also in the lying down position. So these patients also, after within 1 or 2 days, the pain will be over. No? So within 24 hours, he is able to control his blood sugar without any medication. And his pain and discomfort, urinary retention is over within a day or two. And it's comfortable actually the next day, because this patient was sick. Usually we follow the patient on the 8th day, and in between only for the on the online follow-up. But this patient, we asked them to stay and follow up next day also. So by the next day, he was actually comfortable. And the PSA level actually also came down within, actually in the 8th day, his PSA level is 14. 25 it is come down to 14. Because the most important is when the PSA is come down, the patient's confidence will increase even with the treatment. So we follow it up with the this test will be done frequently in the initial stages especially. And his HbA1c level came down to 7.2 without medicine. With the medicine it was higher and it is reduced, and the sugar is only 113, and he's following it the home also, it is 90, 100 and all. So we are also asked him to keep the blood sugar around 100. That is what we want. That is not for anything, just to improve the proper functioning of the immune system and cut off the carbohydrate for the cancer cells. So by the 15th day, the PSA level was 10.5, and by 30th day, the PSA has come down to normal 3.9. See, this patient is actually advised for the prostate removal, most probably, because the patient, he was actually having infection and all. They are not given painkillers or this antibiotics also, but straight away for admission and surgery. That is the reason he came. Actually, if you guys stay in a far off place, actually he came down to here. And by the 30 days, his diabetes is over, his, all the medication is over, and his PSA also is down. See, this patient, maybe because of this infection, that PSA is so high. But already there is benign prostatic hyperplasia. Definitely we had to take his cancer, and we are following it up, and it is also, it's almost 1 year is over. The last visit also, his PSA and the blood sugar and everything is keeping fine. Only thing, last time his HbA1c was slightly high. That is because he is not taking that care. When we are out of the disease, you will start eating more. And but HbA1c was 6.2, but the PSA was 1.9 only. So anyway, there's no cancer, only the diabetes is there. She has to take care of the diabetes. And definitely every 6 months or 3 months, we had to, ideally for another 3 months, 1 year or so, every 3 months HbA1c and the PSA has to be followed up. Next we will discuss about thyroid cancer. This is a 18-year-old boy actually, it's a young person, and 164 centimeter height and 59 kg weight. So, and he is actually, he had tiredness and recurrent fever. For that they have gone to the doctor and diagnosed as a Hashimoto's thyroiditis. And his thyroid function was low, and anti-TPO and TG was high, and started, and also his cholesterol was high. So started with medication for statin and thyroxine they were started. And because there is some difficulty in the throat pain and some difficulty in swallowing, the patient, the child was complaining, and they did a ultrasound scan that showed a few nodular, multinodular, and this Hashimoto thyroiditis type of this thing, and also few nodules. Some of it look like solid lesions, and some as a cystic multinodular goiter sort. And so they go for a biopsy. And in the biopsy, it came out as a suspected case of thyroid papillary carcinoma, and they were advised to undergo a total thyroidectomy and maybe further treatment if needed after the surgery. So because she's so young and they don't want to go for the surgery, that is the reason for the parents came to me with the child. And in this case also, in the clinically supported lifestyle correction, we give optimal nutrition, optimal exercise, and ask them to reduce the cutoff because we are suspecting a cancer. So cut off the carbohydrate also in the initial stage. Then this actually, this patient, even though this young child, he's very following, the parents are very involved, and the child also, because it is very difficult for the children to make them follow the diet and all, because they will be going to school and eating whatever they get. But he was following it up, everything in the correct manner, and we are following it up, the patient with the ultrasound scan every month actually for this patient. And the initial, because the suspected cancer, and we are avoiding delaying surgery, or trying to avoid the surgery. And after 1 month itself, there was slight reduction in the this nodules and even the cystic lesions and the solid lesion. There was reduction. And another thing important is giving the patient confidence was increasing. Was initially he was always feeling heat in the body. By the 30th day, that heat feeling and the recurrent fever and tiredness and all is gone. So he was feeling healthy. And along with that, the ultrasound scan also is showing, and also we are following with the thyroid function test also. Within 30 days, we are able to remove his statin and also the thyroid hormone also. But his thyroid function and the cholesterol was in the normal range. Even in these children, giving this cholesterol statin is it can affect their growth itself, because the statin is needed for the cell growth and everything. So cutting off this thing is really can affect the growth of the pubertal development is taking place now. So in this actually we are following with the ATG TPO also. By the day 90, actually all these parameters we are following it up with this patient. He had so many vitamin deficiencies and all that was corrected, and also the ATG and the AMA and the IgG level, that is inflammatory marker, all this level came down. And also he was having a toxic element, tin was high, that was above 25. By the 90 day it just came down to 18.9. So that is also getting removed, because we are detoxifying. The diet is for, and the exercise is for detoxifying also. So they are confident. By the 180 also they were checked following it with the stent, and it is further reduced. And it is almost a year. Patient is going fine, and he is supposed to go for the next scanning and yearly follow-up also. This sort of patients, definitely they need every 3 months, because when the lifestyle, if you are not symptomatic, the lifestyle can you will always feel eating all the junk food and all will be there. So the weight management and following it up correctly is very important for this patient also. See, we'll shortly go through one more patient. This is a lung cancer patient. It's diagnosed with a small cell carcinoma of the lung, and it is spread to, and the doctor said that there is this cancer center said we cannot do anything, because her kidney is also affected. There was extension to the there was clotting and extension of the tumor cells. Or the MRI scan was showing it is there is a growth into the common iliac also, and he is having pain and edema on the leg also, and his arm also is varicose vein with the arms because of the lymphadenopathy in the mediastinum. The blood flow is not taking place into the heart. The heart blood flow is this thing, and that is the reason for varicose veins. Usually varicose veins we see only in the leg. This patient is bulging varicose veins on the arms also. So they said nothing can be possible in that stage. Actually, the patient was not knowing that he is having cancer also. The relative is not revealed to the patient. In India, it is not a must to reveal to the patient also. So anyway, the patient was very adamantly saying that I should not also say anything, that the patient should not, during the discussion or the consultation also, I should not also reveal anything. The patient should not have any suspicion. Otherwise, they're fearing that whether he will commit a suicide or something like that. So that's a very difficult condition, but he's diabetic also, so because we want to avoid this carbohydrate also, no? So always the better the patient is having an understanding what I'm feeling. The patient should know what is the condition, then only he should take the decision. So it will be easier for the patient to make the food control and all. So this patient, anyway, the patient he had the family was not allowing. So we were forced to give advices without discussing with the patient about the real situation. This patient actually is height is 165 centimeters and weight is 68 kg, and diabetic, hypertensive. The CKD, that liver kidney function is reduced, cardiac, he is a non-cardiac patient, and taking treatment for that also. And so many medicines he was on actually when we are coming. Anyway, because for all this, within a month actually, we were able to come, within actually month, except the Thyronol, which is taken for the thyroid problem, he was able to come out of all the medications, diabetic medicine, hypertension medicine, heart medicine, everything is come out of. So even his weight is also reduced to, by day 60, it has come down to 60 kg. By the time his kidney function also, kidney blood vessels was blocked, and initially his GFR was only 33, and the GFR also increased to, by day 30 it has increased to 54, and day 60 it has increased to 63. So except for this thyroxine, we are able to come out of all the medicines. Externally he was perfectly okay. Only thing, light cough is there, but there is no blood stain. Before that the blood stain was there, and he was actually, he had the follow up to 180 days. 180 also when he are coming, he is perfectly all right. Only thing after that, and his weight has come down to 56. You are asked to bring down it to 50, but he was taking some carbohydrate, like he was very fond of tapioca and rice and vadas and all he was taking. So that is one problem. And after that, actually, the day after 180, his wife fallen sick, and I don't know what happened, but throughout while he was following it up, he was generally healthy, even without knowing that he is cancer, and he is not following his strict no-carb diet, even though he was completely okay in general and as such. And that we should remember that it is a patient with the 4th stage cancer, and said there is nothing, only palliative care can be given. So this can be taken in the 4th stage cancer, and all it can be taken as a palliative care, as a part of the palliative care also. We should definitely include these patients' history. The other patient, breast cancer 4th stage, shows that the palliative care also, definitely the first line of palliative care should be the lifestyle correction. Next is a pancreatic cancer. This is a patient with a 171 centimeter height and only 58 kg to 58.4 kg when she is coming to me, and 75 is the age. He was a non-diabetic patient for the 9 years, hypertension and dyslipidemia. Actually, he was considered this lifestyle correction 3 years back for the diabetes reversal. But finally, at that stage, he was advised to take insulin for the diabetic control. But here, if in the lifestyle correction, he has to control the food. He was not that willing for diet control. So he opted for the insulin injection 3 years back. And he was on insulin 4 times, 4 doses of insulin, and so many other medicines also. And he developed, he was diagnosed with pancreas cancer. And even though the PET scan was done and just showed that there is distant metastasis into the ribs and the bone metastasis and the liver metastasis, and the multiple organs, internal organs also is involved. But he was undergone a surgery on January. Actually, he is coming to me January beginning, and the 6th or so, he was 1st or 2nd. In the early January, he has undergone the surgery, and the distal pancreatosplenectomy, pancreas, distal part of the pancreas, but part of the pancreas is kept, and the spleen is removed, and the stomach sleeve, part of the stomach sleeve gastrectomy is done, and segmental colostomy also is done, and the left adrenal also is removed. See, stage 4 cancer, clearly there is extension into the ribs and this thing, and they were not, even though the cancer unit has advised a surgery on a 75-year-old man. We should understand that such a huge end block removal of all this pancreas, part of the pancreas, part of the stomach, part of the colon, and one of the adrenal gland and the spleen also. So this much of it will be very difficult for the patient to stand. In that stage, actually, he was then advised for the chemotherapy. At that stage, he is coming, and by the time actually he is done in the early 6th or January only that surgery was done. He is coming on 30th January. That is immediately after discharge, he is coming. By the time in the hospital stay itself, he has this bed sores already appeared. So he was so weak. And the colostomy, that the stool is passing through this colostomy bag. The problem is at this stage it is very difficult because he doesn't have the health of doing any lifestyle correction. He is not able to do any exercise, and he started actually, but he is able to control the blood sugar without medicine. We are able to make him out of the medication, but he is not able to take any food. Not only the food we are giving, because the main part of the stomach was also taken out. So that is the situation actually. It is very, when we are in this case I am telling, because when you are deciding on surgeries, especially in the 4th stage of cancer and all, especially in old age people, we should be very, very careful. It will actually definitely increase the sufferings. So if this patient has come 3 years back before he was going for, then he would have been saved from the going into the cancer itself, because we will be reversing the cancer. Reversing the diabetes. When the diabetes is reversed and the medicine is not there, the chance of getting a pancreatic cancer will be very low. And even if he is diagnosed with the cancer, 4th stage cancer, if he has come without going for the surgery, because before the surgery he was okay, he was fine, there was no health issues at all, only some slight discomfort in the abdomen and all was there. The other, like the other 4th stage breast cancer patient, they are working very healthy now also. So it would have been possible, but after the surgery, this much of surgery, and yes, colostomy bag, it will not be able to do a properly into this lifestyle correction. The patient is not in a position for that. Basically, I had explained all those charts with the patient, about the patient. So the concept of cancer is only the chemotherapy, radiation, surgery. That is the overall all over the world. That is the condition, and everyone is afraid, and everyone is going on for all the treatment. But how many are? We are actually, there is no records. If you check also, the result only the 5-year survival rate, 10-year survival rate, those so things are showing. What is the quality of life of this survival also? That is also very important. Especially when we are radical surgeries and radical heavy toxic chemotherapy and all, in the old age, we should definitely, even we have seen the young child which is advised for the thyroid cancer, how it is avoided. So definitely we should develop this lifestyle, the habit of lifestyle correction, even in the early stage of any cancer suspicion itself. So most probably we can reverse it also, even in the early stage. And also the tumor markers, can depend on the tumor markers, not for going for the treatment, because most of the cancer institutes and all, they are not following it up with the tumor markers, because it is not that useful for preventing cancer. If you are preventing cancer, if you are these tumor markers are only used in the case of only this PSA and all, mainly used in the following up with the patient for the treatment, chemotherapy, radiation effective. But it should be used for early diagnosis and reversing the lifestyle problems. Then actually that is the sustainable way of treatment actually. In short, first, cancer is a lifestyle disease. The first step in cancer treatment is to identify the lacunae in lifestyle and correct them. Only by correcting our lifestyle, we can protect ourselves from cancer, help in recovery, and prevent recurrence. Second, with the help of modern diagnostics, it is possible with the help of PSA, CA125, CA19.9, CEA, CIFRA, etc., tumor marker investigations to identify the possibility of the cancers very early, and with the help of correcting lifestyle, prevent progression of the cancers. Cancer can be identified using scanning techniques only after they have reached a certain stage. Third, cancer cells require glucose to grow, and avoiding food that convert to glucose when digested is a major step in recovering from cancers. Fourth, cancer surgery, medicines, and radiation treatments often focus on destroying the cancer-affected body part, its surrounding area, and associated immune system. This reduces the immunity and overall health. Fifth, the imbalance in nutrition, both lack of or excess, the entry of toxins into the body through food, air, skin, medications, excessive metabolic waste in the body that are not excreted properly due to poor circulation, due to sedentary life, imbalance in hormone activity, all contribute to DNA damage in the cell's genetics, which result in mutation which give birth to cancer cells. Sixth, as far as the body is concerned, everything other than food, even medications, are considered toxic by the body. Recent study shows that many medications used for diabetes, hypertension, autoimmune diseases, cancers, etc., when used continuously over extended period, can increase the cancer risk. Seventh, it is our immune system that destroys cancer cells. Lifestyle diseases like hypertension, diabetes, allergies, autoimmune diseases, etc., and the medications that weakens or suppress the immune system result in immune system losing the ability to destroy cancer cells, which result in their multiplication and development of tumors and spread to other parts of the body. Eighth, in diabetic patients on insulin injection, the insulin in the blood will usually be very high. Hyperinsulinemia, high insulin levels, increases the risk of developing cancer. To help prevent cancer recurrence, it is essential to reverse diabetes, reduce and stop the need for insulin injection and diabetic medications by lifestyle modulation, reducing the high glucose and insulin levels in the blood. Ninth, to regenerate new healthy cells, it is essential to provide optimized levels of nutrition, reduce toxic intake through food, body care products, medications, remove stagnant waste products of the body's metabolism, enhance circulation for optimizing oxygen availability to protect our cells from cancer, help in recovery and prevent recurrence. 10. Treatment of lifestyle related diseases like cancers, hypertension, diabetes, allergies, autoimmune diseases, obesity, etc. should be on the foundation of lifestyle correction and not on medication, surgery and procedures only. 11. To reduce tumor load and support the immune system, it may be necessary to use conservative surgery, radiation and medication. As the approach mentioned here is different from what we see commonly, it may be difficult for some viewers to follow this. Today, with some application of the mind and as understanding of the use of PET scan for diagnosing cancer and to evaluate its stage, it will be possible to understand the science behind this approach. Understanding how poor decision making can make the patients and close one's lives even more distressing due to the abnormal fear of cancer, which leads to the increased use of risky surgical procedures and medication with all the side effects and associated suffering, will hopefully help in taking more logical, practical and human decisions with the patient's best interest in mind. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body's parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin levels, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulations can help achieve a reversal of disease process, attain desired body composition and normalize blood parameters. Based on the patient parameters, effort is directed to provide optimal nutrition, physical activity and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse the damages and come out of most of the medications within a month and avoid surgeries provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting a removal of toxin by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medications and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Thomson, started medical education in Government Medical College, Kottayam at 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from government service and in 1997 started practicing as a consultant at Life Care Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medication to protect our children, grandchildren and the coming generation from the ill effects of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in lifestyle modulation. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with a clinically supported lifestyle correction, etc., you may visit our healthcare channel. Thank you.